viewers. Hello, welcome viewers at Better Future Production. We are the Minister of Health, Public Health. We meet Mr. Mudunjai, Director of Health Promotion and Education. We'll be talking about the coronavirus and its ways of preventative methods. Mr. Njai, welcome to the interview.
Oh, thank you, Mr. Sedik, and thank you for coming here to have a discussion with me. And I'm very grateful when we have a Minister of Health to have such a very important media house to come and talk to us. I think Better Future, is it?
Yeah,
Better Future Production. We are happy to have you and to partner with you.
Okay. And to begin with you, Mr. Njai, since the outbreak started in China, it poses an existential threat globally. And now Gambia administered its first case through the Minister of Health and Social Welfare. What is the Ministry's response to the Gambia administering its first case of the coronavirus?
Thank you very much. That's a very important question. We at the Minister of Health are very sad about the story, and then we are not happy to have such a, because we are not even expecting. With the level of preparedness we put in place, we were not expecting to have a single case. It came to us as a surprise, but that will also help us to strengthen our efforts as to what we are doing. And then basically the case, having one case in the Gambia means a lot. So meaning everybody have to work together, all hands should be on deck, and then try to work together as in partnership with the Minister of Health, which is also leading. We also want to remind the public that there is no cause for alarm or panic. The situation is under control as of now because the case is getting appropriate and excellent care at the MRC clinic in Fajara. So, and then efforts are also done to trace the contacts of the particular person. We remember it's a female. Somehow in social media, someone saying 21-year lady. She is 28 years. And then we don't want to disclose certain identities, but she's 28 years, a female for that matter, a Gambian for that matter, who came from the United Kingdom from UK to Morocco and came to Royal Air Morocco with 80-0529 flight. And then I think if I can remember the flight name, and then came to Banjul on the 15th, arrived here on the 15th around 1:40 a.m. And then what we are now doing is now, the team is now working, the contact tracing team is now working with other partners at the airport and other places to identify the contacts of that particular individual. And they have been very cooperative on that one, yeah.
And then for your ministry, you raise some of the preparation plan to send your 11th health personnel at the airports and at the underlying borders to quarantine and screen people that will come via to this transit or via to the airport or the various borders to make sure that we have our stringent preventative methods to alert the public of a suspected case. How does it slip from the airport?
We may not see it as a case that slipped to the airport. The person have gone through the procedures of screening, and then perhaps the time she was coming, she did not manifest the signs and of the coronavirus. That was what we could be. That could be our conclusion. And then basically, perhaps when she went home and she was able to manifest one or two signs, and she decided to seek for care, and then basically went to MRC, and then where the samples she has taken, and she has been isolated. She was even forced under self-isolation before reaching to MRC. But it doesn't mean that she just came and then passed or sneaked. No, the procedures were done at the airport, and as I said, the signs did not manifest at that time, so it will be difficult for one to detect. For example, high temperature and coughing, and then specifically with high temperature. That was what we expected to see at that point in time, but that did not happen at that point in time. Perhaps that could have been an area where that was used as an avenue for her to maybe she was not feeling anything wrong with her system, and she decided just to pass and go. And that is, I'm sure she has gone through the procedures, and then knowing that we have strengthened the airport, no one can escape at the airport. with regards to not going through the normal airport formalities, especially the public authorities, formalities set up by the public authorities at the airport.
Okay. And then many Ali, there are growing fears that the coronavirus, it might also have serious negative impact to the climate. And then in Africa, we had this tropical climate. Does it affect the climate too?
That one, we cannot comment much on that. I personally cannot comment on much on that because that has to be based on research. We have to get research findings and then to be able to determine whether the virus can be able to survive in a cold climate or to survive in a tropical area. So that one has to be, as far as we are concerned, the virus, in my opinion, the virus can survive both in tropics and also in the non-tropical areas. So, but that has to also be backed by evidence of research. And then what we now need to do now, because as long as novel coronavirus, novel means it is new, so therefore it is a new thing for us, and we have to come up with new ideas, new strategies, and new approaches to be able to find out where the virus can survive mostly, and also where it cannot survive mostly, and that cannot be determined by me alone or maybe by somebody else, but it has to be based on scientific research. And then so, as you know, something that is new, there's a lot of research going on about the disease, to know more about the disease, so that one can be able to determine as to what strategies do we need to put in place and where do we think the disease can survive most. And that has to be based on this evidence. And I think the evidence part of it, as I said, hence, when something is new, everybody will like to come in on board and try to make a research, and that's what is currently happening at this point in time. So when we get the research results, as and when necessary, we can be able to communicate to that effect, to say that, well, the virus can be able to survive in it. But as of now, the people who came with the virus came from an area. Because right now, if you look at most of the European countries, it is not the least cold at the moment. Some are facing hot climates over there, but they are coming from those areas and coming here. And then if you look at some of the cases in our African countries, and they are all hot areas. So one cannot just conclude and say it cannot survive in a tropical area. So that has to be based on research findings.
Okay. Yeah. And then what are the preventative measures?
Currently,
to combat the coronavirus?
What we are doing now is to ensure that we enlighten the public, to raise awareness using all avenues of radio, television, and we are happy that your station is also here, your TV station is here with us. We are also engaging our community structures like traditional communicators, community drama groups, school structures, community structures like village development committees, and then these are all structures that we think when we engage them, they can also be able to raise awareness at our community, so that at the end of the day, when everybody is aware at the community level what they do, they also be on the watch out. And that's the whole idea, and that will also help us to strengthen community-based surveillance, because community-based surveillance, its success lies heavily on the awareness level of the population. So when people are aware of a disease, automatically then it can make life easy for community-based surveillance to be conducted. And that's what we are already doing. And we're also trying to do what we call cross-border surveillance. And we are working closely with our authorities in Senegal, and so that we can also be able to work together. And that has started even way before the coronavirus. And what we now did was just to strengthen our relationship and collaboration with the other authorities in Senegal to strengthen our partnership and collaboration. That is also ongoing. If you also look at the issue of points of entry. What we did with support of IOM, International Organization for Migration, they also supported us in trying to build the capacities of port officers, points of entry officers. They include immigration, Gambia Revenue Authority, the police, SIS, phytosanitary and agriculture, and also health. So what we did, the whole idea is to train a pool of people, and each of them, after they train, they go back and train all those who come sort of on the job, or maybe trying to share back to office report and share some of the training, strategies and materials that have been used. So the whole idea is to strengthen collaboration at the points of entry between health and other partners, and that has also been done. So that is also helping us to strengthen surveillance at the points of entry. And if you look at some point, some of the areas, even wherever there are no health workers, you can see the immigration officer will take up the responsibility to start screening, or even try to control the movement of people, or the police officer, or even the GRA, and even fighters. So that shows the level of collaboration at the points of entry is really indeed satisfactory. We're also working on the case management, trying to train our health workers and doctors, nurses, and all other categories of health workers for them to be able to have an idea and understanding of a disease, and also if somebody has to have it, how can we be able to manage that particular person. So these trainings are also started. Since around first week of February, we started building the capacity of our staff, and also on area of also infection control, and that's also something that that is also something that we have also focused on training on. You also look at the issue of public. I also mentioned about the issue of public health. I mean surveillance, for example. What we did, the points of entry, our Director of Public Health Services also went around to be able to assess the level of preparedness at the points of entry, and to see what are the gaps in those areas. So what they did was they were able to map out the gaps and the challenges that some of the staff are also facing. And then yesterday the minister was even in fact advising us that we should prioritize our health workers who are we call them frontliners, and these are the people who are in the points of entry, and they are the frontliners. And the minister has emphasized that they need to be supported, and that is why we are now trying to think of how do we support them in time. In fact, he even suggested that those officers at the points of entry, because there is a building that is already there, he suggested that they need to have better furniture and better living condition there, and also their environment should be at least conducive for them to be there, so that they can also be motivated, because the work they are doing is tedious and it's 24 hours around the clock. So currently we are trying to find, though they have some material in terms of supplies, PPEs and so others, but we're also trying to provide them with some certain equipment like coffee, tea, sugar, gas stuff, so that they can also be doing, and even the minister even suggested that they need to have televisions, just something that will make them comfortable, so that they can also be active and do the work. And we have seen the results. Areas that we have provided some of those facilities, and we can see that people have been active and they've been working 24 hours. So we also have to, the public health department also had to review the existing human resource capacity in this area. So they are able to identify, for example, an area which has 2 and the place is very busy, they have to increase 2 or 3 additional staff to that number. And that has really made life easy for us and at this point in time. So if you look at the airport, there used to be only 2 or 3, and now the additional 9 have been there. So now we have about 11 public health officers who are actively working at the airport, so Abanyo International, likewise the seaport and so on. So we are able to strengthen what we have. So people have the belief that we are a bit late to act, but we want to remind the public that we are also, all our actions are guided by the international health regulation. And international health regulation, we should be very mindful as to what activities we need to implement, so that we don't need to go against the international health regulation 2005. So I mean, we are a signatory to it as a country, so we have to respect it, and we have to abide by it. And so therefore we cannot limit the movement of people. So it is not the Minister of Health to decide, but we have to get the technical advice from WHO, who have to give us that. So because we are a signatory and WHO is the custodian of that particular document, so we have to be very mindful. That's why people are saying we should close our borders, but they don't also need to look at the implications of closing borders. But what we what the government did now currently is to make sure that flights that are coming from hotspots, like for example Germany, America, England, and as well as Italy and Spain, at least those people, any flight that come from that area, the decision we have taken now is to quarantine all those passengers on board for 14 days, and that has been a decision that we have taken, and we are going to go by that, so that we also try to avoid the further spread of the disease in the country, and that will also help us, so that when they are put on quarantine, they can also be managed and observed, and then to see whether they have a disease or not. And after 14 days, when they don't manifest the signs, we have to discharge them. We have to go to their house.
Fellow Gambians, in order to avoid this coronavirus, let us avoid close contact with people who are sick.
In order to prevent yourself from having coronavirus, please avoid frequently touching your eyes, nose, and mouth.
When coughing, cover your mouth like this, or use a tissue, then throw the tissue into the trash bin.
The symptoms of the coronavirus are coughing, fever, and shortness of breath.
If you see any of these signs mentioned, quickly call the health team on 1025.
A message from Better Future Production.
We are advising that there is no need for panic or fear or state of confusion at this point in time. What we have also, the report we are also receiving now, that is also making the public panic, is that they are saying that there are people who are vaccinating. They are going around vaccinating and they are killing people and they are using the coronavirus, and two or three or four people died in certain regions like North Bank, Lara, Sierra, URA. They are now seen everywhere, but those information are all false. We want to make it very clear, categorically clear, that all the information, there is no vaccination program going on. The ministry is not aware of that, and MRC that work with the Minister of Health in doing vaccine trials, they are not doing any other vaccine trial at this country at this point in time. So there is no, because people are just sitting down anywhere, sending messages to people, telling people that there is a vaccination team going around. These are all false. We want to appeal to the public that any information they have, that they want to get clear information from a credible source, which is the Minister of Health, they have to contact the Minister of Health 1025 toll-free number. They can raise their concerns, they can ask questions, and they can also try to visit our website, or they also try to check our Facebook page, Minister of Health, the Gambia. Then they can also be able to have an update. Our advice also to the public is to be mindful of the social media. Whatever they see in the social media, it can be, some of them can be true, and sometimes we have to acknowledge, sometimes when certain people make certain very beautiful comments and suggestions in our Facebook page, and which we normally take, but most people, almost about 80% of the comments are always negative on the Minister of Health. And I think people also need to recognize that we are doing a lot. If you compare our sector, Minister of Health, the Gambia, with other ministries of health in the West African region, you will know that we are doing a lot of work, and we are ahead of many countries when it comes to healthcare service delivery. So people, that also have to be acknowledged by the people who are always criticizing. But we're also happy there are people who have been criticizing us at the beginning. Now with the constant dialogue and discussion, we have never been arrogant to anybody. We respond them nicely, sometimes we acknowledge their point, and we have seen that most of those critics are now, in fact, now supporting us in social media. That is a big plus for us, because we are controlling the social media, and we have seen that achievement. So what we want to do now, because people are all out there to tarnish the image of the government and try to tarnish the image of the ministry, we want to appeal to the public that they should only listen to information coming from the Minister of Health, like what happened yesterday. When the positive case was available, the minister had to go and announce it, and followed by several discussions. Like you can see yesterday, after the announcement of the minister, I had to stay at the studio and JRTS to make sure that we start explaining people what is happening in the local language. That was what we expect, and that was what I was done. We are not here to hide any information from anybody, because we know the implications of hiding information from the general public. One, you are trying to encourage rumors, and when there is rumor, what happened? There is always chaos, and there are crisis, and when there is crisis, then people are panic, and people just send any information. So we want to avoid that. That's why we don't want to keep any information. We give information as and when it is available, and we don't want to rush to give, we want to give credible information from a credible source, and we want people to rely on our credible source as the Minister of Health. We also want people to advise them to avoid crowding, going to crowded places, social distancing. They also need to know when there are ceremonies and programs, all those things they need to suspend them according to what has been stated in the statement for 21 days. And this is another way of a public health measure. It's another way of a public health measure that will also help to prevent the further spread of a disease. This is a public health. It's not political. It's a public health measure, according to the guidelines of Public Health Act and Public Health International Health Regulation. The only thing you can do to spread the further spread of a disease is to make sure that you cut down. Certain events that will attract people to be together. The special viral diseases like this, so you can also spread very quickly when people are gathered together. That's why gatherings are suspended for now. Lumos are suspended for now, because why Lumos? People will say market, but Lumos are areas where that will attract people from Guinea-Conakry, Guinea-Bissau, Casamance, Senegal, and they all come to Gambia. Or sometimes Gambians will also move to the Lumos. So that is why that interaction, that is what we want to break. So for now, we want the councils. The councils are the ones that are working. So we want the other councils to also to help us to try to engage the people who are operating the Lumos to ensure that they abide by the laws. And we also want the madrasa schools, the schools that are operating, all the schools, and including madrasas and daras. We want them definitely, the policy applies to all of them. Because we want to avoid people being crowded environment. We want to avoid people to be gathered together in a crowd or sort of. So to avoid that, all other areas that will encourage crowds, I think we are discouraging that. We want people also to we want to appeal. It's not, it has nothing to do with the religion. It's not against the religion. It's not against the rights of the people, but just for a temporary measure. Just for 21 days, we want to appeal to the public to definitely help us to do that, to implement it. Otherwise, if they don't want to implement it, meaning they are going against the policy, and then if they are going against the policy, there are laws that will also help you, be applied on people. And also when it comes to information of dissemination of false information by the social media, we want to appeal to the all social media platforms. It's a crime to disseminate false information, especially at this time of a public health emergency. Other countries have applied laws, and I think for countries like Kenya, if we are able to disseminate false information to the general public in this time, they will charge you $15,000 or you are jailed for 1 year or so. So we also want to apply. We also have a law that deals with the dissemination of false information to the public. That will also cause chaos, and so we have to look at that. Those things are there, but we don't want to go into that. We want to advise people on social media platform to send out credible information to the public and not to cause panic. We want to advise them. We also want to advise them, the public, also to be practicing hand washing and with soap, and they also want families and caregivers also to talk to their children at home, to teach them on the practice of hand wash so that they can grow up with that. So as they grow up with that, they can also inculcate in them, and they can also be able to practice hand washing with soap at all times. That will also help us. We also want them, if anybody who is coughing or sneezing in public, you either use handkerchief or use the bent elbow just to sneeze or cough, and so that you can also, because if you use it with your hand, the tendency for you to mistakenly touch somebody will be higher. So it's better you use the bent elbow. That will also be helpful in that area. Just like doing like this. That will also be very helpful. So we want to also encourage people to do that. And also, if we also want people now to use our 1025, people have challenges in it, in going through the line, because of we had only 4 lines. But today, as I speak to you now, Pira is helping us. They are training our people. That's why today this place is empty. They are training them, and they're trying to, they will give them phones, and then also, in fact, it's not only here, it's all the regional staff. They will give them phones, and also each of the GSM companies also are going to add additional 4 lines, meaning each of the GSM companies are going to give us 5 lines. So if QCell give 5 lines, Official and Comium and then Gamcell give that, I think we're going to reduce the load on the 4 existing lines. So we want to appeal to the public to work on that. So there is one single case of coronavirus in this country. That should not cause any panic or fear among the general public. But rest assured, we are here to you. We are here. We'll support you along the way. But we also equally want the support of the general public, so that we can also be able to address this menace that is really affecting the African continent, especially Gambia.
And then finally, in short, what is your last message to avert people's misconceptions on the coronavirus, in the spirit to eliminate
the misconceptions? We are now saying it is a real. The disease is real, and people are now saying it. In fact, even for the case for the Gambia, people are even saying it's not true. It's real. Coronavirus is real, and people have to be mindful of it. They should also be observant, and they also need to know that it is around us. So what we need to do now is to protect ourselves, and the protection is very key. We want to advise people to work on that. And also we want to tell people that nobody, there is no cure for it as of now. What we can do, what can happen now is to treat the symptoms. But basically, we will see people who are coming out. They will be saying, they will start claiming that I can treat this, I can do this, I can, So all those things will happen. We will be seeing them. We want people to be mindful. Let them be on the watch out. And there is no vaccination going on currently on coronavirus. There is none in this country. All that information they are seeing on social media, people are out there, they're trying to distract what we are doing. So that is, all those information is false. We want to appeal to the general public to listen to us. The advice is coming from the Minister of Health, and WHO is working very closely, because whenever we send out, we get the information from World Health Organization country office, the Gambia. Thank you very much.
Thank you.